Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. Let's take a look at this example of a female 48 years old who presents with forefoot pain. In this case, I have an example of a normal plantar plate to show us. When we're looking at forefoot issues in general, we'll be looking heavily at the transaxial and the sagittal images. The sagittal images give us a great idea regarding the biomechanical alignment of the foot, at least in this position. And the axial images really help us to dissect out the individual anatomy, slice by slice and millimeter by millimeter. What I've loaded up for us here are 3 fluid-sensitive sequences, all with fat suppression. I also have one T1 weighted sequence, which is where the fat in the intramedullary canal and the subcutaneous regions are demonstrated. Looking further at these images, taking a closer look at the sagittal images, let's take a look at the second metatarsal phalangeal joint, looking at the cortical bone of the metatarsal head and the proximal phalangeal base and the fat suppression. We'll be looking to see whether or not there's any kind of stress response or fracture in these bones. Looking further, we can identify right away that plantar plate 2 centimeters long, roughly 2 millimeters in thickness, no elevated signal within the plate, at least seen here. We do see this region here consistent with a plantar plate recess. That would be no greater than 2.5 millimeter, and we can measure that here in any plane. So here, again, pretty constant at 2.5 millimeter or less. We can see the plate firmly attaching to the proximal phalangeal base as seen here. We can also appreciate the flexor tendon as it approaches the joint line, and then we'll continue on the digitorum longus, moving to the distal phalanx. Moving to the transaxial image, we can appreciate moving from proximal to distal, the U-shaped structure of the plantar plate, how it blends into the region of what will form the floor and the deep transverse intermetatarsal ligament region. Here's your flexor tendon with its flexor tunnel, and we move into the plantar plate, moving into the region of the metatarsal head. And once we're at the point of the deep transverse intermetatarsal ligament, we can begin to consider these the accessory collateral ligaments and the proper collateral ligament. Furthermore, at the level of the deep transverse intermetatarsal ligament region, we're going to begin to form a convergence of the interosseous tendons with the proximal phalangeal base at that level. We're going to join the lumbrical tendon and form a thickening of that interosseous tendon complex here. This one is slightly thickened, and this one is more on the normal order here. But nonetheless, what that represents is a superficial reinforcement of the whole plantar complex. And many times we can see that that is either thickened or torn. So in the case of a normal plantar plate, again, what we'll be looking for is that U-shaped plantar structure, the plantar plate, blending imperceptibly with the flexor tendon. We'll be able to see the accessory and the proper collateral ligaments as a complete U-shaped structure supporting the MTP joint. We will begin to see reinforcements at the tibial side of the distal joint capsule, where the interosseous tendons of the dorsal and plantar interosseous musculature will join up and form reinforcements all along that medial side of the capsule. And that is your normal plantar plate imaging. A few more things we'll look at besides just the plate. We'll be looking at the region of the intermetatarsal bursa. We can see that again transaxially as the interosseous tendons decussate and move towards their capsular. They create a potential space that can fill as a bursa, and that's your intermetatarsal bursa. The deep transverse intermetatarsal ligament being the structure between M2 and M3. That's the terms given to metatarsals. And then superficial to that region, you can see the nerve artery vein complex. And then distal to that region, we'll begin to see further changes of the interdigital nerve. And we can see that with detail on T1. So here what you're seeing are at the level of the proximal phalangeal base, distal now we are, you're seeing the 2 limbs of the nerve that have, the interdigital nerve that have come together in this region here. And again, moving back into the foot, we're looking at the muscles of the dorsal and plantar interosseous musculature that are basically forming the capsular reinforcements that further support the medial plantar complex, seen here. And the presence of a neuroma generally is thought to occur from friction against the deep transverse intermetatarsal ligament. So when we have a neuroma, it is felt to be a symmetric enlargement in the middle of this interspace. But a pseudoneuroma lesion, which I'll show you other examples in other videos, you'll start to see that the enlargement of the nerve moves towards one of the regions of the plantar capsule. And that's indicative that the region for the neuromatous inflammation is secondary to a plantar capsulitis. So distinguishing the type of inflammatory or perineural fibrosis that's occurring may help us to further distinguish our patients and help them find their forefoot wellness again. Thank you for your time and attention. Are you ready to take your podiatric imaging skills to new heights? Check us out at RadPodSquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.